Good afternoon, everyone. We are going to wait a minute or two more. We are expecting a few more people to join, and so we welcome having you on our webinar this afternoon, and we are going to get started in about a minute or two. All right, we'll go ahead and get started. My name is Darcy Freedman. I'm the director of the Swetland Center for Environmental Health. And I'm excited to have such a great group join us today for a conversation focused on green space, health, and well-being, a synthesis of systematic reviews. In a minute, you'll have an opportunity to interact with our three presenters, Rachael Sommer. Rachael is the Director of Partnerships and Operations within the Swetland Center. Kyung is a postdoctoral fellow, and Gill is a pre-doctoral fellow within the center. Next slide. For those of you that are not familiar with the Swetland Center for Environmental Health, we are an academic research center within the School of Medicine at Case Western Reserve University. And the mission of the center is to study the complex interplay between the environment and health. We place special emphasis on investigating environmental determinants of health inequities to translate these findings into policies and practices that promote community and population health. As you can see in this slide, our work is in three broad areas: research, training and education, and community engagement. And at the center of the slide, you can see that, our goal is to bring all of these together for community system science for environmental health equity. And key to the work is really this focus on community engagement. And what you're going to hear today really came out of community engagement, came out of conversations with community partners, and clearly any type of change that would be focused on improving green space and access to parks would have to happen in partnership with the community. Next slide. I'd also like to acknowledge that the research that we'll be presenting today was conducted through support from a generous partner, the F.S. Livingston Mather Charitable Trust. And we are grateful to all of the partners and sponsors that provide support for the Swetland Center. To get us started, probably by now, all of us have been on at least one webinar, and so you know that there are some logistics that make it easier and more useful to the group. We would ask that everybody is just respectful of each other and ourselves, and to be patient. We are getting better at using technology like this, but sometimes there are a few glitches. One of the things that you'll notice in your, if you click on the, or kind of move your cursor to the bottom part of your screen, you'll see some pieces of information. One of them is the mute button. It's a little microphone, and everybody is on mute right now. However, we will open up for questions later on, and we do invite you to unmute yourself and come on board. You can also use the chat feature, and in the chat is an opportunity to type in a question or a comment for all of the panelists, or you can share it only with select people. And the Q&A function, again, at the bottom is a place for you to put in a question, If you're interested in posing a question to one of the speakers, you can use the Q&A function to add a question for us to come back to. One of our team members will be monitoring those along the way. I would also like to go ahead and now transition to providing an opportunity for you to introduce yourself to each other. If you want to go ahead and type into the chat box your name, the organization that you're representing, and to spice it up a little bit and given the topic of focus, we'd like for you to include your favorite green space in Greater Cleveland. And again, you can just type that in the chat box, and that way you'll get a sense of who all is joining us on the call today. In addition, as you're providing these introductions, I want to just let you know a little bit more background about how we got to this point. As a center within the university, we have an opportunity to engage with a lot of great partners in the community. And in that way, we start to hear common questions coming. And one of those common questions was this idea of what is the value of green space and parks to the health of communities? What do we know about their effects? And then where are the gaps, or where are the opportunities for additional research? And I want to give particular credit to the Trust for Public Land, Western Reserve Land Conservancy, as well as some conversations that we've had with University Hospitals, Harrington Heart and Vascular Institute. All of them in very divergent ways came to us over the past 4 months with that common question. And as a center, we said, why don't we take some time to pull together all of the literature that's out there and have a common tool that we can use locally to guide future conversations around the connection between green space and health. And so the result that you'll be hearing about today is as a product of that, initial conversation. And I mention that to say that, if there are other questions on your mind, please bring them our way. We know that there are a lot of ways that a research center can be of support to the community. And one of them is, kind of pulling together the state of the science. And so that's kind of an orientation and entree now into our first presenter. And just, before I transition over to Rachael, I do want to acknowledge that we have such a great group of people. And you guys are giving me some exciting places to visit. I see some acronyms in here like CVNP from Amber. I'm not exactly sure what CVNP is, so you might want to put that in Cuyahoga Valley. Okay, because I'm seeing the ledges. I love the ledges. Any other places in here that we might need clarification? Okay, all right, thank you guys. All right, so go ahead now and transition to Rachael Sommer. Thank you.
Thanks, Darcy. And I'm really excited to be here with all of you today. And also let me figure out how to start my video. Okay, now you can see me. All right, so I also want to do a little warm up with everyone here as we think about what green space means to us and what that looks like. I want to take a minute or two to share 1 or 2 words that come to your mind when you're thinking of green space. So how would you describe it? Like, what is green space? And this will kind of lead into our conversation today. So like I always think of, I like places that are covered in a lot of trees, because even though I love the outdoors, it gets really hot out in the summer and I like to be shaded, and I also like to be close to rivers, even though that's maybe more of a blue space. I see some comments in here. Fresh air can definitely relate to that. Peace, lower blood pressure, so access to nature, trees, health. I see a lot of like stress relief and kind of the mental health side of green space and how that can impact our lives. Inspiration, recreation, sense of belonging. Wow. Air quality, again, kind of to that being able to breathe and breathe clearly. Wellness, trees, relaxation, health. These are some really great and descriptive words here. Cooling, democratic, renewal, connection. So, yeah, this is great. I love to hear how you guys are describing green space and what it means to you. I think Kyung's been taking note of your guys's descriptive words here, and I think she is going to be sharing an image with us. I see restoration again. Kyung, are you able to share your screen? Thanks. All right, so there's our little word cloud tree of all your guys's words and descriptions of green space put together. And I'd just like to point out how varied they are and how they cover a lot of different aspects of green space, even though, you know, green space is one word, but in this group even of 20 or so people, we're defining it in a lot of different ways. That's really cool to see. Thanks for putting that together, Kyung. And I'm going to actually go back to my screen and share. Hopefully everyone can see that. But one thing that we have found in research, and as we've conducted this review of systematic reviews, is that green space has been defined in many different ways. And so even in this room, you may have put those words in there depending on your own personal experiences, the disciplines you come from, where you live, and many other factors. So because this is the same kind of trend we see in research, it can sometimes become a challenge when we're looking at the outcomes from studies that are conducted on green space and how that impacts health. But we wanted to share for reference, here is how the Environmental Protection Agency defines green space. So green space is an open space of land that is partly or completely covered with grass, trees, shrubs, or other vegetation. Green space includes parks, community gardens, and cemeteries. And we know that that is not even all inclusive, but that is kind of a standardized definition that has evolved. I did want to point out that we did see some trends in terms of how green space was defined across research. So one way we saw green space defined was the use of categories. Common categories that we saw used were planned and unplanned green space. So examples of planned green space consisted of things like parks, street trees, and also community gardens. So the examples you see on the top of your screen here are examples from our fair city. So if you recognize on the left there, Wendy Park, and the center are some trees lining the streets of Shaker Heights. And on the far right side is Benjamin Franklin Garden in Olds, Brooklyn, where I live. And I know we have representatives on the call from that community, one of our oldest gardens, largest gardens. But examples of unplanned green space include things like forested areas. So you can check out this photo from the Cuyahoga Valley National Park, which I heard was a favorite of many of you. And then also another example of unplanned green space are marshes. And here is a picture from Mentor Marsh right here in Northeast Ohio. Two other common categories we saw and used across green space research were private and public. So when we say private, we're referring to things such as backyards or gardens. And this is a garden that was featured in the 2014 Garden Walk, which is an event that's hosted annually in Cleveland, showcasing home gardens across the city. Examples of public green space may be things like playgrounds, ball fields, or again, community gardens. So Up at the top there is a picture of a vineyard on East 66th Street, and then Forest Hills Park in Cleveland Heights at the bottom. One thing that became clear from our research is that it would be very difficult to create a universal definition of green space. However, by being very specific and using both qualitative and quantitative criteria to create your own unique definition, it will make it easier for others to compare and replicate evaluations and outcomes in similar projects. So in this table, you'll see some examples of the criteria that were recommended to consider when creating your own definition of green space. While I don't have time to walk through each of these today, there are two that I would like to point out and highlight. One is space. So in Greater Cleveland, I think we all know that, size. The size of our spaces can vary a lot when we're talking about parks or other green spaces. When you think about somebody who might want to be looking at the outcomes of a park's impact on health, and they're comparing to a project that you've done, they want to make sure that they are planning for a similar size park or green space so that the outcomes and their evaluation measures match. Additionally, access and amenities can be incredibly important considerations when planning and evaluating outcomes and impacts of green space. So I think we all know that not all places and spaces are created equal. As you can see here, they give examples of including things such as amenities for low mobility residents, paths, curb cuts, and benches. All of these are points to consider when preparing for your own projects, collecting and sharing data. Now I'm going to turn things over to Kyung, who is going to review quantitative and qualitative measures of green space.
Thank you, Rachel. So as Rachel mentioned, there are different ways to measure green space, both quantitative and qualitative ways. And one of the most common measures, one of the most common ways to measure green space quantitatively is using NDVI, which stands for Normalized Different Vegetative Index. And this is one of the most common ways to measure green space and has been commonly used in various epidemiological studies. NDVI basically is based on sunlight reflections by plants. These are satellite images from above that can determine the density of green space based on colors or wavelengths. So similar to how one can measure body temperature based on colors, red being a representative of warm and blue being an indicator of cold, green space can also be examined in a similar way. Red tends to absorb sunlight, so reflection tends to be lower. And so for NDVI, it is indexed as -1 to 1. And green tends to reflect more, or even blue, like water, how it reflects more. So that is indexed as NDVI 0 to 1. So these are quantitative numbers that can measure green space and used in epidemiological studies. There is another common metric, next slide, tree canopy. This is also another quantitative way to measure green space. And tree canopy, by definition, is layers of trees, branches, stems of trees that cover the ground when viewed from above. So similar to NDVI, tree canopy also can be assessed from above, based on satellite images. But what's different from NDVI is that tree canopies are only assessing anything related to trees. So anything like leaves, branches, and anything that's non-related to trees are excluded. So grass or gardens are not excluded in tree canopy assessments. So those are the only difference between NDVI and tree canopy. There are two approaches to go back to the slides, please. So tree canopy can also be tracked by satellite images or collecting, going to the fields and actually collecting tree inventories, sizes, and then analyzed. Next slide, please. There are the qualitative ways to measure, or ways to measure the quality of green space, and one of the common ones is park score index. And this park score index was developed by Trust for Public Land for creating parks. And it was developed to create scores or rank the largest 100 US cities based on different scoring criteria. And this was based on within 10-minute walk from houses or from residences. And this scoring criteria includes population density, park size, whether they have restrooms or parks for dogs. All of those criteria are considered to rank these parks. As you can see on the right side of the slide, there are maps. There is a map that based on this scoring criteria, 100 representing the highest rank or the top ranked. And as you can see, there are quite a actually 4 parks within Ohio is within the top 100 ranked parks. So one in Cincinnati, Cleveland, Columbus, and Toledo. Next slide, please. And as you can, as mentioned, Cleveland, based on park score, is ranked 29th. And there are a lot of parks here in Cleveland. I think that's one of those things that Cleveland should be very proud of. Almost 190 parks within Cleveland. And within this park score, within what is very interesting is that within the website from Trust for Public Land, there is also information about the demographics that are composed within those 10-minute walks from parks. So, such as like socioeconomic and race. And I mean, this is just a little bit interesting from research perspective because previous research has, hypothesized that socioeconomic status might be related to, access to parks. But based on these statistics, low income and high income, there wasn't any too much difference in terms of accessing parks. So considering all these aspects of maybe like behavioral aspects or other environmental determinants such as whether they are feeling welcome or they want to go to parks are some of the important things to consider in research beyond the quantitative aspects. We also, if you would like to know a little bit more of this park score, I think in the audience we have someone from Trust for Public Land as well as from Western Land Reserve Conservancy. So if you would like to learn more about the park score and street canopy, please feel free to follow up after the webinar. Next slide, please. And lastly, Walkability Index is also used to assess the quality of green space. And although this was developed by EPA, and although it doesn't directly measure green space, it has been used in combination with the quantitative aspects. So Walkability Index measures the likelihood of walking as a mode of transportation, and this is score 1 to 20, and this is based on, again, some of the scoring criteria such as street intersection, proximity to transit, employment type, whether the employment is related to, is associated with more walking or not, and housing housing units within neighborhoods. Next slide, please. And so to finally, since I've gone through some of the quantitative and qualitative ways to measure green space, in order to assess health outcomes based on using those quantitative and qualitative metrics, one can examine health outcomes, whether it be based on buffers from within residential proximity, so how much one is exposed to green space within certain buffers and health outcomes, as well as based on distance from the closest park or green space, and also based on scores or qualitative measures that I mentioned, park score or walkability, or combination of many of those, both quantitative and qualitative measures. So now I'm going to turn it over to India, who is going to actually discuss about the health outcomes associated with green space.
Thanks, Kyung. So our team searched the literature to find the most current systematic reviews associated with green space and health outcomes. And for those who are unfamiliar, systematic reviews are a type of a literature review that uses reproducible methods to collect secondary data and synthesize the results for a specific topic area. And they're designed to provide a complete, exhaustive summary of current evidence. In our assessment of 9 systematic reviews, which were all published within the past 10 years, we found evidence that exposure to green space is associated with positive health outcomes in both adults and children. Some potential pathways that green space contributes to health include a moderation of temperature, absorption of air pollution, and providing opportunity for physical activity. So in our review of the literature, we found overall a 12% increase in self-reported good health, 13% decrease in preterm birth, 18% decrease in stroke, 28% decrease in type 2 diabetes, and 31% decrease in all-cause mortality or death. Next slide, please. In the 2 systematic reviews that assessed the impact of green space on mortality, meaning death, there was evidence of an inverse relationship between greenness and all causes of mortality, meaning that with an increase of green space, the authors observed a decrease in all causes of death. Most notably, there was a decreased risk of death caused by cardiovascular disease. Findings from the systematic review examining crime and violence, specifically murder, assault, and theft, illustrated mixed results. Authors found that the presence of parks and other green spaces could reduce urban crime, and a potential mechanism here is that with an increase of presence of parks, that would lead to more desirable social interaction and recreation, to which then improves community perception and eventually reduction in crime. It's important to note, though, that studies on gardens seem to have the highest results in terms of seeing reductions in crime. The authors found one study where violent crime increased as the number of city-owned parks increased. So suggesting that green spaces with such an open public place where strangers may be less identified by members of the community may create opportunities of crime. So there's mixed results for the relationship between green space and crime. Regarding childhood asthma, there was no evidence of a significant relationship with residential greenness. And I was a little surprised by that. One potential reason why there was no evidence of a direct association between green space and child asthma is because of large inconsistencies in the way that green space was measured between studies. These inconsistencies could be too large to accurately analyze the association. However, there were reduced child asthma exacerbations with an increase of exposure to greenness for children with difficult family relationships, children living in high traffic volume neighborhoods, or children exposed to tobacco smoke. There was another systematic review that assessed multiple health outcomes on green space and the great outdoors. The authors synthesized findings from a comprehensive list of 143 papers, which is a huge amount of papers. And as I shared earlier, they found that exposure to greenness is associated with multiple health benefits, including reduced diastolic blood pressure, heart rate, salivary cortisol, which is a biomarker of stress, type 2 diabetes, stroke, all-cause, and cardiovascular mortality. Next slide, please. So we also found a systematic review that solely examined the relationship between green space and obesity. However, again, there were mixed findings on green space and physical activity. Though there was evidence of a positive relationship between green space and lowered body mass index, which is the measurement used to assess obesity, there was a lower prevalence of obesity-related health outcomes with more green space. There were also mixed findings from the 2 systematic reviews on mental health. The first found limited evidence of long-term residential greenness exposure and mental health benefits in adults, and inadequate evidence for green space and improved mental health among children. However, authors from the second systematic review found a significant evidence of decreased emotional and behavioral problems, such as depression and anxiety, with increased residential greenness exposure, particularly with hyperactivity and inattention problems such as ADHD among children. Next slide, please. So of course, we need to consider some of the existing benefits and risks related to green space. So here we'd like to share 3 benefits, which include providing space for physical activity, social interaction, and cohesion, as well as improving community perception. Another benefit is reducing air pollution and noise pollution, and then also heat, and also reducing stress and improving relaxation and restoration. That was one of the things that you guys mentioned earlier when you thought about green space, is relaxation and restoration. Some of the risks include promoting space for crime, enhancing exposure to environmental pollutants, and increasing risk of vector-borne diseases such as Lyme disease. Next slide, please. So research in green space has grown and gained significant attention over the past decade. However, much remains to be studied given it's a relatively new field of research. And some of the research gaps within green space include a lack of a common definition for green space. Also, there's no standardized measurement of green space. For example, sometimes green space is measured based on a percentage of exposure versus maybe high, medium, or low exposure. Also, there's a lot of studies that use the NDVI index that Kyung shared earlier, but the buffer range changes for green space. It could be between 30 meters to 3,000 meters surrounding a home. So that makes it difficult to compare findings across studies. Another research gap is the lack of a comparison for those exposed to green space and those not exposed to green space, as well as a need for a longitudinal assessment, which is an assessment over a longer time period of pre and post exposure to green space. Future research should include a meta-analysis of green space and health, since we need more concrete quantitative understanding of its impacts, and most systematic reviews have not included any meta-analysis. For those unfamiliar, a meta-analysis is just a statistical procedure used to combine the results of multiple studies from a systematic review. And so also future research should include a targeted intervention or policy implementation studies to assess how effective green spaces can really be. Further assessment also of the role of socioeconomic factors and social determinants of accessing green space, since it remains unclear whether socioeconomic factors independently contribute to lack of access to green space, or whether there are other social determinants that need to be considered further. So this concludes this portion of our presentation. Please let us know if you have any questions. Please feel free to type them in the chat.
Great. Thank you so much, Rachael and Kyung in India. That was really helpful and provides a summary of the literature. We now want to open it up to the audience. If you have any specific questions and would like to hear more about any of the studies, we can open it up first for just questions about the systematic reviews. Or if you're interested in learning more about the measurements of green space within communities. So you can either type in the chat or you could unmute yourself and ask your question. Okay, so it looks like we're pretty good on the questions so far. I think that I'll go ahead and ask a question to the group, and those of you that are doing work in the area of green space. What are some opportunities for us here in Cleveland in terms of evaluating the impact of green space on health and other kinds of health related outcomes? Do you know of projects that are being done that would be a great opportunity for us to be able to get at what India was talking about, this idea of a longitudinal study, that ability to track over time what happened before and after. That's one of the biggest challenges in environmental health research, is we often don't have a comparison. So you're not you know, you don't have a group that wasn't exposed, and unless you have that, it's difficult to be able to say, well, the reason why we saw a change is because of whatever the exposure was, a park, and it wasn't just some sort of natural change that was happening in the community. So I see Jeff is putting in that Old Brooklyn is going to be building a 26-acre park this fall. Jeff, do you want to unmute and share a little bit about what you're doing and maybe how you're thinking about it as a community health promotion strategy? If you go to the left.
Yeah, no, I figured out. The just took me a second. So certainly we, you know, we conducted our own community health needs assessment a little over 2 years ago, identified green space as a barrier to health within the neighborhood, which frankly and candidly was pretty damn surprising to us because we often boasted as a community development corporation of having more acres of park space than any other neighborhood in Cleveland. Whether that's true or not, we said it. So, but what we discovered is that where the parks were located had a huge impact on access, and we found a large chunk of the neighborhood did not have access to a park within a 10-minute walk. And so this particular space is an old construction debris and demolition landfill that was closed probably 30 years ago now. And in partnership with a few others, yeah, it's going to be, construction is commencing in August for a new 26-acre park. And I would love to explore kind of a pre and post or longitudinal study on nearby health impacts for residents, mental, behavioral, educational outcomes, obviously physical health. I think there's going to be 3 different trail connections from the park into the surrounding neighborhood. So I think it's a neat opportunity to have a pre and post evaluation.
Great, thank you so much. And in terms of your timeline, you said you're going to be starting in the fall. Are you, like, when do you imagine that the park would actually be finished?
Ribbon cutting will probably be the spring. There's a chance that ribbon cutting happens before winter, but right now the construction timeline is not assuming any trees or landscaping this fall, just the hard construction done this fall, and then the landscaping done in the spring.
Okay.
Darcy, I also wanted to point out that we have some questions that have come through the chat, the Q&A, and a hand raised. There was a question about statistics on green space. I did want to just point out some interesting facts from the systematic review that we looked at relevant to crime and green space. So one thing that I thought was significant when it came to studies that looked at gun violence, they found that studies focused specifically on gun violence do support the hypothesis that green space reduces violence. Out of the 9 studies they looked at specific to gun violence, 6 had those expected outcomes. And we made the mention about parks earlier versus gardens, and I just want to illuminate that when they looked at the impact of parks on violence, so there was 10 studies covered in that systematic review. 3 out of 10 saw a reduction in crime, 2 out of 10 were inconclusive, and 3 out of 10 saw an increase in crime. So, you know, India kind of alluded to earlier, like the thought that there may be individuals who are less known out in the public space where crime can occur. The point about community gardens was that there is the sense that community gardens are easier to implement. They're a little more affordable. They can be done and scaled on many different sizes, from, you know, a couple plots in one block to multi-block areas, and done very efficiently, quickly, and affordably. And people feel a greater sense of ownership over those spaces because they do spend time, invest their own sweat equity in their own potential personal dollars in the cost of garden fees and things like that. And so that maybe could point to a potential reason why they saw a higher, more often of a reduction in violence related to gardens. And the same kind of thing they saw happen with improving lots. Especially there was some studies in Philadelphia that looked at the greening of lots, and I think for similar reasons, but I don't want to take up all the time here. So I want to, I can definitely follow up and send that to you. We also have a question from Tim C that says, it's highly relevant to community research interest, policy, and philanthropy choices. If it is starting to look like there are health benefits, should this be considered as part of zoning policy? And I think any of our presenters can speak to that, or Darcy. I say yes.
Yeah, I think that, you know, and maybe somebody else on the line could chime in as well. You know, how are zoning policies taking into account green space? I know that there's been some movement for health in all policies and really looking at health impact from various policy decisions, but I'm not exactly sure where green space fits in that kind of an evaluation for local policy. Does anyone on the line know?
I know we have city planners in this virtual room. If you want to unmute yourself or raise your hand and we can unmute you. So we also had a question come through, and I know I missed a raised hand somewhere. Sharon says, is there a way to measure residents' comfort level with visiting green spaces near their homes? They seem to be near them, but there are many reasons they would not go there. Do they feel welcome or wanted in these spaces? Great question.
I think that is a really good question. And I would agree that this is maybe something that should be considered for future studies, for future research for green space. So we talked a little bit about some of the different quality metrics for green space, but I don't see a lot in the reviews that we that looked at that actually include perceptions or comfort or anything like that with visiting the green spaces that are near their home. That is a really, it's really important to consider that. You might have a green space that's right next door, but do you feel safe going there because it might be a dangerous location? So that's definitely something to consider for future research.
Yeah, and I think it brings up the value of having qualitative and quantitative measures, which was brought up earlier. You know, what are the features of the green space that make it accessible? Then potentially you could be measuring that more quantitatively.
So someone raised their hand and I missed it. I think they put it back down now. If that was you, can you unmute yourself or put something in the Q&A or chat? I don't want to miss anybody's comments.
You see, it's Elizabeth Grace.
Hi. I just wanted to piggyback on the comment that Jeff made from Old Brooklyn. We are actually the park, it's called Brighton Park, and we're the owners of that property and helping out with the construction and the development of the park. We also received a grant to plant 2,000 trees on that site. So that might be an interesting pre and post evaluation of how the trees impact the folks that live right around the park. And we haven't planted them yet, so we still have a pre.
And when are you thinking you'll plant the trees?
We're hoping to start this fall, pending COVID regulations, but we plan on beginning in the fall, probably October or November.
Okay.
We have a related comment in the chat. Ruth Epic says, the Cleveland Tree Plan represents an intervention that might be studied in a longitudinal study. How could we do that?
Yeah, and I think the Cleveland Tree Plan, because it is not, you keep hearing me ask this question of when is it going to happen? And I think the challenge with designs that get a pre and a post is that you have to have enough time to get your pre. And with the tree plan, knowing that it doesn't all happen at the exact same time, it actually also allows you to, you know, have a comparison, because potentially areas that are going to get trees later could become a comparison to the group now that's getting the trees now. So I think I agree. I think looking at the tree plan and looking at timing in particular, and area, you know, variability in where trees will be planted is a good, you know, place to start to think about the research. There's also a question here from Callie Mersman, and I think maybe Rachael or Kyung, talking about the distinction between public space and green space. And did you see research that looked at benefits of accessible and welcoming public space in general, like plazas, street events, etc.?
This is Rachael, and anybody who wants to add to it. So our reviews specifically looked at green space, although in some of the studies they identified other descriptions of spaces, but more I saw kind of things like, oh, there was a lot of descriptive words, but they even had like blue space for places where there might be like water or lakes. Although some of our green spaces also are public and open spaces, we didn't look at that specifically, but I think it is something that is definitely research worthy in this current place and space we're in, especially we've been talking about this in light of COVID. We're all trying to find new ways to join together, whether that's virtual or in public, socially distant, and what do we consider public space? I heard even, you know, Zoom or online platforms are considered to be a public convening space, but I know that events and activities such as open streets across the nation and across the world have provided meaningful places for people to gather and recreate, and there has been research done on open streets initiatives that have shown health impacts and impacts on our environment, such as improved air quality and community togetherness. And so those are types of initiatives we're starting to see pop up in various forms, even more so now during COVID. So I've heard a lot about even people hosting more block parties and closing streets to recreate and spend time together as a community. Block parties aren't exactly open streets initiatives, but it's along the same thought of how do we use our public space and our public right-of-ways to be together, be healthy. And so that's definitely another opportunity for research. I don't know if anybody else has comments on that.
Yeah, definitely. I think another, you know, like I think some of the research, I think there's still like research lacking on the impact of indoor versus outdoor. A lot of the studies that we've examined are mostly outdoor, so definitely something to look into, whether, you know, indoor or outdoor, public versus private might have benefit.
I see there's a comment here from Amber Jones. She wanted to share some information about qualitative research that they conducted last year. She held focus groups with Old Brooklyn residents regarding their perceptions of green space. I'd just like to give her an opportunity to share if she would like to before we move on to the next section.
Sure. Hi, everyone. I'm Amber. I work with Jeff over at Old Brooklyn Community Development Corporation. Last year, we had a case student from the MPH program who actually conducted focus groups. We had 7 groups throughout our neighborhood to kind of hear how people use green spaces, what kept them going back or what kept them from actually going, what were the barriers. And it was just a really interesting conversation to hear and kind of learn from, so that we could do a better job as community development and working with our partners to figure out, goals and future plans, especially as, we're doing this to improve the impact for our residents and improve their health. So it was just a very eye-opening experience and kind of what they were thinking. And so I'd be happy to share a little bit more about that if anyone is interested in reaching out.
Amber, can you just share maybe one or two things that stood out that made a green space was prioritized about the green space?
Sure. So I think one of the biggest, so there were 5 different categories that we looked at last year, but just having an active space. So what's available within those spaces for people to actually do. And then one of the more interesting things was how much people actually wanted to utilize the space, not just in the summer months. So, most parks or outdoor spaces are only good from April to maybe the beginning of November. But what about during those winter months that we have? But there's not much activities or programming available during that time, and that's really what was keeping people from utilizing it more often. And if anyone's interested, my email is amberj@oldbrooklyn.com.
Thank you. If you wouldn't mind putting that in the chat as well. I saw we also had a comment from Kristen Trolio. Cleveland Metro Parks has completed one study and will be continuing the study again this fall on the effects of walking in green space versus sidewalks and city streets. We will gladly share results. That sounds really amazing. Research measured cortisol, also conducted focus groups on what types of green spaces different populations prefer, and that kind of brought up in my head about how we were talking about equity in space and how not all spaces are created differently. So, when we think about parks may or may not be a space where community feels like they can gather. So looking at how public space or public right-of-way, streets, sidewalks, what are the impacts of that on people's health, and are there spaces in their own communities where they would feel more comfortable gathering versus a park if that's not something that is, maybe it's accessible, but it's not a safe space for them or a place where they feel comfortable. I know we have, thank you, Kristen, and I think we'd all love to hear about the results of that. We have one, maybe we have time for 2 more questions. We have one question in the Q&A from Chanel. For the study, what sort of elements do you need? The City of Cleveland creates about 4 to 5 new parks every year.
So I think some of the things that we would need for that is, coming together, one, about what is it that, what effects do we want to study? And I think you heard from the group today a number of outcomes that have been studied related to green space and health. Clearly there are some gaps. There are also some areas where it seems like there's some clear effect. So, what's the effect that we're looking at? Because that's going to drive measurement. Are we looking at mental health? Are we looking at physical health? Secondly, we would then want to look at, how do we make sure that we have a group that is exposed to the park and a group that's not exposed, and then be able to have comparisons over time. And so I think where it would be helpful with a broader group is to come together, to define what are the most important indicators or the most important needles that we are interested in studying, and to see if they actually do move through the introduction of a park. I also am hearing that there is a lot of variability too in what is a park or green space. And are we interested in one kind of park? Are we interested in a variety of parks? As well as, so for example, in a very planned, structured way, a playground equipment versus a community garden, as well as, what's that process of building the park? Is it a community engage method for development? Is that going to yield different kinds of engagement than a, you know, policy, you know, we have to put a park in this neighborhood because it's, you know, that time according to the plan. So, you know, those are the kinds of questions that we would want to hash out and then think about the design, you know, to study that impact. And if people are interested in that, you know, that the purpose of having the call today was to, one, share, but also then to see if folks are interested in you know, kind of moving to a study, we can then have follow-up calls and, you know, sort of lay out the design and plan for that. So the last, we only have 4 minutes left. One of the other questions that we had, and we really didn't get to it at all, was questions related to COVID-19 and parks and green space. We know that they have been a big source of sort of escape during this period of time, and clearly the importance of parks and green space has been elevated. You know, when really they've become one of the only spaces where people could sort of take advantage of getting away. So I think it just raised the importance. We're very interested in continuing the conversation. You can see our email addresses here. If you're not already connected to the Swetland Center monthly email that we send out that kind of gives you an update on the work in the center, please follow up. I would directly email Rachael within this group. If you signed up to receive our scoop, we call it the Swetland Scoop. It comes out the first Monday of the month. You should have received one in the beginning of June if you had signed up before June 1st. But otherwise, you know, that's one way to stay in touch. Directly following up with us if there are specific opportunities to move things forward. We will say that, you know, we are very excited about these, but we know that it is to do the kind of research that will look at longitudinal impact. It requires additional resources, and you know, this is where we'd like to see how can we partner and sort of layer on community transformation, rigorous evaluation, and you know, how can we go collaboratively to secure additional resources for that work. So we're open to the conversation, and you can freely share the data brief. It is available on our website. And you know, thank you to our partners in particular who reached out and said, you know, can you help us curate this information in a useful way? So without further ado, we're going to adjourn for today. And we look forward to staying in touch and hearing about some of the work that was described here and finding ways for this group to stay connected in the future. So thank you.